COVID-19 has had very huge impact in the African continent. And we know that COVID-19 has been affected cities highly. So cities are the epicenters of this pandemic, with over 95% of these cases reported in cities. And we know the reason this is happening is because we know cities are the gateways, from other continents and so forth. And this pandemic, we know, was transmitted from other countries into the African continent. And also, when you look at the structure of African cities, there's a lot of concentration of risk. Thinking about the virus and how it's transmitted, the congestion in our cities allows this to also transmit fast. And also, when you think about the infrastructure, whether in terms of health and physical infrastructure, then there's a limitation, and that gets cities to be most adversely affected. So when it comes to the measures that the governments in Africa and also in other places to curb the spread of the virus, we know that most of these measures, especially the lockdowns and curfews, actually led to adverse socio-economic impacts. For instance, when you look at the graphs we have here, that shows some of the projected growth in several African cities. And in all the cases, the projected growth under COVID-19 is actually way less. So with some of the countries actually experiencing negative growth. Again, when it comes to urban areas, you find that most of our urban areas depend on the informal economy, and especially those living in slums. And in Nairobi, within the first month of lockdown, we actually had 81% of the population losing their livelihoods. So within 1 month of lockdown and curfews, then we had people that could not be able to sustain themselves. So what does this mean when it comes to resilience? Can we be able to say that Nairobi or other African cities are actually resilient when it comes to supporting the urban population and especially the poor in socioeconomic terms? And so this gets us to have to revisit our current perspectives of cities and the structure of cities, and be able to highlight some of the potential factors that we need to focus on and that we need to follow through as we start to rebuild our cities post-COVID-19 to make sure that they can be able to withstand some of the stresses and shocks that they're going to experience, because as we are experiencing COVID-19, we also have other shocks and stresses that cities face every day. It's just that maybe sometimes they're not able to get the attention that COVID-19 has been able to attract from governments and other policy makers. So going forward, why do we need to focus on African cities when also this is affecting other regions and other parts of the economy? So we know that in Africa, cities generate about 50% of the region's GDP. And of course, this is even higher in other countries like Botswana and so forth. And so what happens in cities has an impact on the overall region, and can either enhance or threaten sustainable development. So we are talking about the SDGs and how to achieve them. And then within 1 month of a lockdown, then most people are not able to even sustain themselves. So what is it that we need to do in our cities to make sure that they are resilient and they can be able to sustain the economy, they can be able to sustain the population, and so forth? And again, Africa future is going to be urban. We know that in the next 5 years, in 2035, a majority of the African population is going to be living in cities. So as we think about rebuilding our countries post-COVID-19, then cities have to be at the forefront. And we need to think about how to rebuild cities that can be able to sustain this growing population and the rapid urbanization that is taking place in the African continent.